Prevention of COVID-19 takes a cooperative effort. Along with cleaning and other mitigation practices, there are 4 health behaviors to be practicing. Washing hands regularly with soap and water or with an alcohol-based sanitizer, particularly after coughing, sneezing, and blowing your nose, after using the restroom, before making or touching food, after touching animals or pets, before and after caring for someone who needs help, before and after school or work, and after you put on, touch, or take off a face covering. Wearing a face covering. Cloth face coverings are effective at reducing the spread of COVID-19, especially when both people who may come into close contact are wearing one. Remember to wash cloth face masks on a regular basis. Physical distancing as much as possible. COVID-19 is mainly spread by close contact. The rule of thumb is 6 feet, but in settings where that is impossible, stay as far away as you can. Any distance can help. The combination of face coverings and physical distance significantly lowers the chance of exposure. And staying home if you are sick. If a student, teacher, or employee has any symptoms of COVID-19, they should call a healthcare provider and get tested, even if the symptom is mild. Testing locations can be found at coronavirus.utah.gov/testing locations. The most common symptoms associated with COVID-19 are fever, cough, shortness of breath, decrease in sense of smell or taste, sore throat, and muscle aches and pains. It is the responsibility of parents and guardians to administer temperature checks and keep their child home if they are demonstrating symptoms, or strictly follow health department guidance in the case someone in the household is in the process of being tested or is awaiting test results. Schools will be able to perform temperature checks for those who are demonstrating symptoms or other situations as appropriate. If a student is demonstrating symptoms of COVID-19, they first need to be sent to the school's designated isolation room. The student's parents will be notified to pick up their child from school right away. After the student leaves, the isolation room will be cleaned by a custodian wearing personal protective equipment. If a student or employee tests positive for COVID-19, or if a member of their household tests positive, or if they have been directed to quarantine due to direct exposure, the principal or supervisor must be notified as soon as possible. When doing so, personal identities must be kept confidential, with the exception of reporting requirements. From here, the principal or supervisor will complete an initial tracking document and contact their director and the designated lead nurse. At this point, the lead nurse and the principal or supervisor will work with the health department for contact tracing and any necessary communications to families. Affected employees will be directed to the benefits office, and custodians will provide enhanced cleaning in affected areas. Directors will provide support where needed and coordinate with the lead nurse and local health department if large-scale actions are warranted.